Good evening, everyone. A very warm welcome to Liver Cancer Awareness Month, a nationwide public health campaign organized by Voice of Healthcare in collaboration with Izai Pharmaceuticals. I am Dr. Muskan Ahlawat on behalf of Voice of Healthcare, and I will be leading today's discussion. It is an honor to have all of you here showing your interest in understanding and protecting one of the most vital organs in our body, the liver. Liver cancer is often called a silent threat because it may develop quietly without any obvious symptoms in early stages. This makes it particularly dangerous as many cases are detected only when the disease has already been progressed. The liver performs severe functions like it detoxifies harmful substances, stores energy, helps with digestion, and supports metabolism. When the liver is not functioning optimally, the effects can ripple across the entire body. In today, fast paced world, our lifestyle, dietary habits, alcohol consumption, and exposure to viral infections have increased the risk of developing liver disease as well as liver cancer. This is why awareness and education are so important. Knowing the early warning signs, understanding risk factors, and taking proactive steps can make a real difference in prevention and early intervention. Today, we are extremely fortunate to have Dr. Shivam Singla, a consultant medical oncologist at SL Raheja Hospital, Mumbai. Dr. Shivam will help us understand basis of liver cancer, how lifestyle and diet affect liver health, and provide some practical advice for protecting our liver. So, without further delay, let's welcome Dr. Shivam to begin with our session. Hello, sir. A
Thank you,
very warm
Dr.
welcome.
Muskan. Your name and your personality matches very well. So you bring smile
Mhm.
on everyone's face. Thank you for the
Yeah.
nice introduction.
Thank you so much, sir, for joining us. So we would like to begin with very basic questions with you. That Dr. Shivam, can you help us understand why liver is considered such a vital organ in our body, and what role does it plays in maintaining the overall health?
See, a man without liver cannot live. Liver is the most important organ of the body because it gives you energy. It is the powerhouse. So, like you have power storage units where they will be responsible for supplying the electricity to the city throughout the day. Similarly, liver supplies electricity or energy to our body throughout the day. We don't eat 24 by 7, but liver makes sure that our body gets enough energy 24 by 7. The second major important function of liver is to detoxify all the chemicals that we eat or consume. And the third major function is to metabolize our food. So without liver, our we won't be existing. So liver is one of the most important vital organs in our body.
Thank you, Dr. Shivam, for breaking down this so clearly. With that in mind, we would like to know and explore about that. What exactly is liver cancer, and what are some major signs and symptoms of liver cancer that people should watch out for?
So liver cancer is a disease where there is cancer cells which originate in the liver itself. Now, liver can get affected by cancer where the cancer comes from outside of other organs and affects the liver. And liver can be affected by cancer when the cancer develops in the liver itself. Liver cancer typically happens in individuals who consume alcohol or have hepatitis. Typically, these are two major reasons for developing liver cancer. But the other major reason which is emerging these days is the fact that liver cancer is happening to individuals with obesity and with non-alcoholic fatty liver disease. That is something which we are all carrying is the fatty liver. So a lot of our patients now are non-alcoholic. They are non B or Hep C positive. They're basically obese and they have a long-standing diabetes, which is very poorly controlled, and this leads to development of the liver cancer itself. So patients typically complain in late stages with symptoms of jaundice, in early stages with symptoms of poor appetite and loss of weight, and in late stages with development of fluid in the abdomen, which we call as ascites. These are the symptoms of liver cancer. Jaundice happens when the urine becomes very dark, the bilirubin level goes up, and the stools become relatively white in color. So that is the development of the jaundice.
Thank you, sir, for clearing the early symptoms that people should look out for, like jaundice, ascites. So, moving onwards to its prevalence. So, as a medical oncologist, what would you say that how common is liver cancer in India? Are there any particular age groups or gender or regions that are more affected with this?
So initially, when 12 years back or maybe 20 years back, liver cancer was not very common in India, but now it is becoming very common. We would get about 4 to 5 patients per 1 lakh population, and the number is ever increasing. The annual incidence will be about 25 to 30,000. That is reported incidence, but the real numbers will be much higher. The age group is typically it affects the age above 50 years. That is when the liver damage is at the peak, and these patients are above 50, 60 years of age. Now, what I'm seeing also is that it is developing in the younger population. I must admit that the liver cancer is common in the Ganges belt. I do see a lot of patients who have from the Ganges belt itself developed liver cancer. It is more common in females with obesity or males with obesity, and it is more common in diabetic people who have a long-standing diabetes with poor control.
Sir, as you were mentioning here that younger population is getting prone to this disease. So I have a doubt, like when should a person get into the process of screening for liver cancer?
So, unfortunately, there is no screening process for liver cancer for healthy individuals. The liver cancer screening program exists for patients with cirrhosis, liver cirrhosis. So, all the patients who have liver cirrhosis should undergo an ultrasound or the MRI of the liver every 4 months. Healthy individuals should look at maintaining a good body surface ratio, good BSA, and good BMI. So, this will be a vaccine, sort of vaccine for them against the liver cancer. So, as a healthy individual, we can prevent getting cancer, but we
Hmm.
cannot screen for it. So, I think this is something we need to look for.
Thank you so much for explaining this, Dr. Shivam. Talking about our lifestyle nowadays and food habits that we follow. So, my next question is related to that. Are there any specific foods, nutrients, or supplements that can actively support liver health and potentially, reduce the risk of developing any liver disease or liver cancer?
So, any diet which is lesser in fat and highly rich in antioxidants, like fruits, vegetables, this is the kind of diet which the liver needs. The liver does not need an oxidant stress. So, with the red meat diet or a high fat diet, which subjects liver to sort of oxidant stress, this is where the liver cancer incidence increases. Also, lack of exercise is one of the most common cancer reasons for liver cancer. Individuals don't exercise even up to 2 hours a week. I think once they start exercising at least 2 hours a week, rigorous exercises, the incidence of the liver cancer in our population will go down. The other way of reducing the incidence of liver cancer is take vaccination. So there is a vaccination against hepatitis B. There's a preventive and a screening process for hepatitis C. So individuals should take care that they do not develop this hepatitis, which is a liver inflammation and a liver virus that can lead to increased risk of liver cancer. So these are the three things which individuals take forward. The chances of liver cancer will go significantly down.
Okay, thank you so much, sir. As you were mentioning about vaccination, is there any specific age group that a person under this age or above this age should get that vaccination, or any person can take that vaccination?
Any individual should take a hepatitis B vaccine. Nowadays, kids are all vaccinated against hepatitis B. The incidence of hepatitis B and hepatitis C infection is through bloodborne or through needle pricks or through contaminated blades. So these are the reasons of getting hepatitis B or C. These vaccines are easily available. People can take it at any age.
Thank you so much, sir, for explaining about nutrients. And we all know that prevention is always better than cure, so everyone should get the vaccination. So, as we move onward, sir, most bright festival of the season, Diwali, is coming up. So, I would like to ask: can short period of overindulgence during festivals can cause overlasting liver damage, or the liver is resilient if we proper take care of it afterwards?
I don't think indulgence short period is a problem. The problem is we don't exercise. So individuals can indulge short term in sweets or a limited amount of alcohol, that's fine. But individuals, when they do not control it, it's a bigger problem. So if you are exercising enough, you should enjoy your life. That is the purpose of living. The problem in India is that we have a very carbohydrate rich diet and we have a very high sugar rich diet. So we have a very low protein intake. And majority of our diet is high in calories. For example, if you eat a bhujia, which is about 400 kilocalories, it's a lot of stress for the liver because we don't exercise at all, and that is what is happening. The liver has to convert everything into fat because it is loaded with all the calories. Once it converts everything into fat, then it becomes very difficult for the fat to be in a place where there is supposed to be no fat, and that is liver, and it causes damage to the liver. So I think people should look forward about their life, maybe 5-10 years forward, and see where they are going to. If they want to remain healthy, then people at the age of 20, 30 should stop eating junk food and stop avoiding indulgence into alcohol or carb diet and start exercising. The change is today. It's not about a festival. India, you have festivals throughout the year. So I don't know if you are restricting yourself to one festival, how are you going to justify? How are you going to justify throughout the year?
Sure. Thank you so much, sir, for explaining these practical tips. So, as we have talked about basis of liver cancer, can you throw some light on how to diagnose liver cancer or how to diagnose a liver disease?
So I think the first test which people should do is get a liver function test that would show the liver enzymes being up and down or bilirubin being up and down. It's a simple blood test which is done. Then the other test is that people should look at the ultrasound of the liver. The liver disease starts with the fatty liver, grade 1, grade 2, grade 3, and this then develops into a cirrhosis, and this then develops into liver cancer. We have a tumor marker for liver cancer, which is known as alpha fetoprotein, but that's also a blood test. But this is done somewhere in cirrhotic patients where we know that this is going to develop into cancer. So for me, prevention, community-based prevention is better. So once people start exercising, they will reduce their chances of developing liver cancer.
Thank you so much, sir, for awareing us about this. So, talking about basis of liver cancer diagnosis, nowadays, technologies at boost and treatment are getting higher and higher on stages. So, what kind of treatments are available nowadays that a person suffering from liver cancer or a chronic liver disease can watch out for?
Um, so I didn't get your question. What kind of?
Treatments are available
So
nowadays.
treatment options are amazing. I think one big change which has happened is that treatments are good. Now you have drugs which can reduce obesity even if you don't want to work out. I think Munjaro and other drugs everyone is taking, it's become a fad. The easiest option is to exercise. So for me, for liver cancer treatment, the first treatment is exercise. When you discuss about the treatment options nowadays for cancer treatment, majority of the treatment is targeted treatment, where we are able to give small pills to these patients and they recover very well. We are also doing a lot of immunotherapy and targeted therapies for these patients, which is completely eradicating cancer in majority of our patients. Those patients, majority of them had a lifespan expected of 3 to 6 months. Now they are surviving for many many years because of the innovation in science. For liver cancer, we also do liver transplant, which is an option. We take the liver of a donor and implant it into the patient, and this also gives a lot of support and life to the individual. So people should come forward if they have liver disease. There are good treatment options available which can reverse your disease process. But the major important process remains is exercise because that is what helps to burn the fat from the liver, and then the liver improves significantly.
Thank you so much, sir, for explaining the treatments that are available worldwide nowadays. You mentioned about transplant. So, if a person is suffering from liver cancer and then they get liver transplant, can they still develop liver cancer again in the new liver that they have got transplanted?
Yes, they can. Primarily, the chances are low, but they can if they don't take care of their new liver, if they continue to abuse alcohol, or there is a cancer cell which is outside of the liver at the time of transplant, invisible at that time, it can go and affect the liver again. Post transplant, people are at high risk of developing other cancers also because of the treatment that we give post transplant, the immunosuppression, which prevents the liver failure. So they are at high risk of developing cancers, yes.
Okay, thank you. Thank you so much, Dr. Shivam, for highlighting all the tips for liver cancer. So, on that note, before we wrap our decision, I would like to have a quick myth versus fact segment with you, that where we will address some of the most common misconceptions around liver health. So first would be that, sir, after heavy drinking or having heavy eating at some night, people believe that drinking plenty of water, exercising, or getting sleep the next day will, quickly flush out the toxins that they had last night. So how true is this?
Toxins in your body can only be flushed out if they are metabolized by the liver. So if you have a habit of consuming toxins, you have a potential process of insulting your liver. So damage will happen. The lesser damage will happen if you hydrate yourself and other things, but damage will happen irrespective. Once the toxin goes in, there is no way it can come out without hurting your liver.
Okay, okay. Thank you so much, sir, for clearing this fact. So, second would be that there is a most common notion that moderate alcohol consumption is completely safe for liver. So, is it true, or even moderate
Any
drinking?
any alcohol consumption is dangerous, and any alcohol consumption should be avoided. There is nothing as moderate, there is nothing as low, there is nothing as high. I am yet to see a scientific book which says any amount of alcohol is good. No alcohol in any way is good for you.
Okay. Thank you so much, sir, for sharing your valuable insights today with us. One last point that I would like to know from you, that any practical tip that you would like to give our audience today that they should follow during their whole
So
life.
have lots of fruits and vegetables. Exercise at least 2 hours a week. Try to use stairs, avoid the lifts, and try to do your own work. Avoid alcohol and smoking. It is a transient phase where you like to enjoy life, but it leads to long lasting damage on your organs where people like me have to deal with them. So, although it brings us a lot of prosperity treating you, but in deep down in our heart, we wish that you remain healthy. So, please adopt a healthy lifestyle and don't fall sick. And listen to Voice of Health.
Thank you. Thank you so much, sir, for joining us today and sharing your valuable
Bye bye.
insights.
Thank you.
Bye. Thank you so much.